All right, welcome to the Let's Talk series. The Let's Talk series is a 30-minute video discussion between myself, Dr. Becca, Dr. Amanda, and a local practitioner who understands pelvic health on topics pertaining to women's health and wellness. This series was created to help women navigate their pelvic health wherever they are on the path of womanhood, to advocate, navigate, and collaborate together with a holistic team of allies. Pelvic health healing is multidimensional, and the best outcomes occur with a team-based approach. We invite you to tune into our monthly series to learn more about your pelvic health and engage with our community partners. So welcome to Brittany Sharpe McCollum. Today we will be discussing perineal massage in pregnancy. So Brittany is the owner of Blossoming Bellies Holistic Birth Services based out of Philadelphia, Pennsylvania. Her pelvic biomechanics training workshops for clinical and non-clinical birth professionals and expectant parents are conversational, hands-on, and encourage the development of skills to reduce intervention, increase labor efficiency, and empower the birthing person. Brittany's workshops combine well over a decade of experience in supporting and educating parents and training and mentoring birth workers with a multidisciplinary research-based approach to movement, drawing on resources from obstetrics, kinesiology, physiotherapy, and anthropology. Brittany is honored to be a sought-after guest at the international childbirth-related conferences, including the NNEPQIN conference in 2022, Evidence-Based Birth Conference, the Midwifery Forward 2020 conference, the ICEA 2020 virtual conference, and the ACNM Midwifery Day conference, among others. She is the creator of the ICEA curriculum on reproductive anatomy and pelvic structure and a contributing author to the book Baby Got VBAC, an inspiring collection of wisdom for better birth after cesarean. So we have a celebrity on our hands here.
Seriously, no. It's a little overwhelming.
Oh, stop. Not at all. No, definitely not.
Just such a beautiful person to share all of your knowledge and just your heart with the community.
Thank you. Thank you. This work is it's so important and I'm so passionate about it. And so it's just really exciting to be in a position where not only am I working with expecting parents to help them feel more empowered, but also working with clinical providers like obstetricians and midwives and nurses, because when we have that kind of like what you were talking about with the series, when we have that collaborative care, it just makes such a big difference in terms of birth outcomes, both physical outcomes, but also emotional outcomes from the experience. So being able to have like both sides of the coin there, working with parents as well as providers, is really awesome.
Yeah, that's huge, because I feel like there's many providers who are just on one side of the table or the other. So you really have just put yourself in a beautiful place.
Thank you. It doesn't mean that every single provider is like, yes, tell me more about movement. Yes, let's push with the knees together. No, It's not like that at all. It's usually, it's like maybe planting the seed here and there. And so maybe like slowly over time, they start incorporating different techniques or thinking about things a little bit differently or shifting their perspective, or they see something happen like once and then they're like, oh my gosh, it does work. This can happen. Yeah. So it's like, kind of like plodding along, but it's, there has to be change somewhere. It has to start somewhere. So
yeah. Well, that's what we were just saying when we were kind of doing our little, saying hello before we started recording, is like, we're not just changing like what each one of our businesses look like. We're really changing what it looks like for like one of your clients who was like going in for an induction all of a sudden. And she's like, oh, I'll be back, at 6 weeks. And it's like, no, we should be like right up at the front being like, okay, we're going to schedule you 6 weeks from now, or even 4 weeks, or even 24 hours for some people, depending on what's going on. So it's just changing the whole mentality and the culture of birth and postpartum healing to begin with. So
yeah. Absolutely.
So I know you guys have had a lot of conversations together about perineal massage during pregnancy. It's been a little bit of like a hot topic around the birthing community lately. So I'm really excited to kind of dive in a little bit deeper and be part of the conversation and invite everyone in on the conversation we're having. But I don't know, Dr. Amanda, do you want to explain what is perineal massage?
I can.
To start for our listeners.
I think perineal massage from a physical therapy perspective, when we learn how to do intravaginal muscular massage, it's called modified feels massage typically. And that is really just working on the pelvic musculature and helping them have better mobility. Very similar to if you were to massage a shoulder or create more range of motion in the shoulder joint, it would be the same thing. So it's interesting. I have not yet to take a class that has said 100% this is what perineal massage is. And that's one of the interesting things of the research that was shared, is that perineal massage fluctuates from hold something from 30 seconds or 10 seconds to 2 minutes. So I think for at least at Breathe Life PT, as we're doing perineal massage specific to prenatal care, is that we are finding a muscle intravaginally, so the superficial muscles that are closest to your labia, and then the deeper muscles that are closest to actually holding up your organs. There's multiple layers of the pelvic floor, and if you'd like to learn more, Becca has a whole series on it. But we are finding the muscles and literally applying about maybe 5 pounds of pressure to a muscle and just meeting it where its tension is, and then kind of holding it there and feeling, is there a release? Are we getting something from that? Or is the muscle actually fighting us? I mean, when I first started pelvic therapy, oh gosh, it's getting to be almost 10 years ago, like it was just do that modified Thiel's massage and really stretch and almost like scrub the muscle out. But we also were being told that that was appropriate to do for a trigger point in your shoulder. So like things are changing in the mentality of, are muscles really something that need to be massaged or stretched? And is that beneficial? So it's kind of interesting to see from, the internal pelvic floor, vaginal or rectal work, that there are differences. I know for us, when we do perineal massage, we don't just address the superficial muscles or the deep muscles. And I know from, if you want to share about it, experience, we do way deep. We do tailbone work. We do little work along the ligaments as well. And we help the rest of the core system, including the back muscles, the sacral position, the pubic bones, the adductors, everything kind of work together. So I think when we heard about this, perineal massage that was getting poo-pooed on, I was like,
yeah, we were like, wait, what?
Wait, it works for us.
Yeah.
But I think maybe we see it in a different perspective because maybe we are addressing more. Now that I can't say that that's for every pelvic therapist or every nurse provider that's sharing this information, but yeah. So hopefully,
Yeah.
That was a little more than what the question was.
I think that was really a really great description. I love that you talked about how comprehensive the evaluation that you do is, because I think that there are a couple of pieces missing from obstetrical research on perineal massage. One is that it's not a holistic look at the pelvic floor and the pelvic structure and the ligaments. It's like, okay, we're going to really get into just kind of boil it down to perineal massage. We're going to tell people to do it for X number of minutes, and they're going to do it from this point of pregnancy on this number of times per week. But it's not it's not an individualized approach to what's going on in this person's pelvic floor versus what's happening in this person's pelvic floor. Nobody is collaborating, at least from what I've seen with the research. There's no collaboration with pelvic floor PTs in the research either, which, one of the things that I think is really terrible about our current reproductive healthcare system is that it's so disjointed, that the OB that you see for your pregnancy is going to tell you at 6 weeks, okay, great, you're cleared for exercise, you can go do what you do. Like that's not good. Like nobody should be getting back in. Obviously, Amanda, you've told me this so many times.
Right.
Nobody should be doing exactly what they were doing before at 6 weeks postpartum, unless they have been thoroughly evaluated. But we also see this with pelvic floor issues because providers are not saying okay, let's do collaborative care. Let's go see a pelvic floor PT as well. If somebody comes to them 3 months down the road or 6 months down the road with incontinence or prolapse, then it's like, okay, here's someone you should go see. But let's talk about it in more of a holistic sense, as pelvic floor physical therapy is preventative and healing, as well as useful in a situation where there's actually a complication occurring. So I like the way that you describe that. And I think that's one of the problems that we have with a lot of obstetrical research, but particularly in regards to perineal massage, is that it's not taking an individualized approach. There are some benefits that the well done studies we have shown with perineal massage, but even in that situation, just kind of randomly assigning people to this group and telling them, okay, do this is not at all what what you guys are doing when you're working with somebody individually and helping them to, maybe restore postpartum health to their pelvic floor or prevent damage to their pelvic floor through working with them in pregnancy.
Yeah, I mean, in the research, I think it was great to see that, somebody is at least doing it, and that there are benefits that, there was positive research that shared that it was, less maybe grade 3, grade 4 tearing, less episiotomy, but it wasn't like how, when Becca and I talk about it, like we go over breath, we go over like how to communicate with your partner, even just that creating that mind-body connection. And I thought one of the biggest things with the research that was presented that I thought was the qualitative report that the client, the birthing person, felt satisfied with that experience of doing perineum. And I'm like, who would have thought? You get the brain involved, everybody's happy. And that's kind of our approach. I mean, definitely here, but for both of our philosophies, that's our approach of like, we have to get the brain and body connection.
Yeah.
So do you want to speak to that more?
Well, yeah, I think so much of what we're doing, not just teaching someone how to physically perform perineal massage, but educating them on their bodies, on their pelvic floor. Oftentimes might be the first time this person is even seeing their vulva or feeling their pelvic floor muscles, connecting in within the body so they can feel, okay, what does it feel like when I'm relaxing my pelvic floor, when I'm contracting my pelvic floor, to really kind of create that connection, because so often, we don't get any education about pelvic floor in health class or school or anything like that. I don't think even during pregnancy, people get much education on it from their OBGYNs or anything like that. So a lot of times it's the first time these people are really becoming aware of that part of their body and what's going on. And I think there's a lot to say that, besides just mechanically stretching the tissue, there's a nervous system response that comes with it as well, which I think probably has more to do with it than actually physically mechanically stretching a muscle tissue. But I think most people, enjoy the experience because it's an opportunity just to learn more about their body, not necessarily because, they, only had a grade 1 tear. Like that's a great, would be great outcomes as well. But I think the opportunity to really connect in and learn more about our own bodies is where a lot of the benefit really comes from.
Absolutely.
In general.
Yeah, absolutely. Oh gosh, yeah, that's a whole nother conversation. But Britt, how about with you when you're, educating through all of your childbirth preparation classes? What do you share about perineal massage? Because I know when we first met, it was like, wait, I don't want to do perineal massage. And I was like, but have you ever experienced any of it? So tell me from your personal perspective, but also your evidence-based perspective as a provider.
Yeah, sure. So my personal perspective is very different than my professional perspective when I'm teaching birth classes.
Yeah.
So when I was like, nope, I'm good. I don't want perineal massage. Thanks anyway, Amanda. That's totally a different approach than I would take in a birth class. In a birth class, when people ask me about perineal massage, we do talk about the research because I teach evidence-based classes, but with the goal of taking an individualized, holistic approach to the laboring process. So we talk about what evidence-based decision-making looks like in the first place, which means the research is part of what we discuss, but then there's also provider recommendation. And then there's also the person's individual preferences or priorities. So perineal massage is a great example of how to utilize that evidence-based approach. So we have some good research, well done research on perineal massage in the obstetrical world. And then we have some not so good research in the obstetrical world. So basically what I let people know is what the research says. And then we talk about other things they might want to consider prioritizing to protect their pelvic floor. And we talk about resources like pelvic floor PTs that they should be incorporating into their care in pregnancy. And then after providing all of that information, then I tell people it's your decision as to whether or not you want to do that, but it can be a great way to, like you guys were saying, get in touch with your body. And I think for a lot of people coming to my birth classes, they come to class with this feeling that they want to learn more about birth because they quote unquote know that they don't have any control over it. And I can't emphasize enough to people that they have far more control than they know. And part of that sense of control, or the word I love to use for birth is autonomy. Part of that sense of autonomy in birth comes from connecting with your body. And if perineal massage is a way for someone to connect with their pelvic floor, then that has benefit whether or not it's going to affect somebody's tearing. The other thing is that when we're talking about like the research on perineal massage, the research does show that there is a decreased likelihood of tearing in first-time parents. And a lot of times it's first-time parents coming to my birth classes. What I always think is interesting with the other results that some of the research shows is that it shows a decreased risk of episiotomy, which is so interesting to me because an episiotomy is a specific intervention. It's not like the body doing something on its own. So I wonder then if that means that people are refusing episiotomies or having more conversations with their providers about their desire to keep their pelvic floor intact. I could just kind of wonder how. I would love to like actually be there and seeing any communication happening, because I always think like, to show that something like that decreases the risk of intervention that a provider would have to do.
Right.
That's always interesting to me. But you know, that with that research too, it was done in situations where there are very high episiotomy rates, and episiotomy rates should ideally be really low. And episiotomy is honestly, I don't see them happen in births as often now as I did even 10 years ago.
I agree with you.
So that's a good thing. But anyway, going back to what you had actually asked me, I think getting in touch with someone's body, like with their own body, is so important. And perineal massage is a great way to do that. And I think a lot of people are like, they're kind of looking at it as like this kind of weird thing, but it's not weird. It's not weird at all. It's your body. And I think that along the lines of internal exams too, one of the things sometimes we touch on in birth class is like, yeah, you can totally feel your own cervix. People are like, what? Feel my own cervix? Like, yeah, it's not that hard to find. Like, it's in there. You know, not that they'd necessarily be like, okay, I'm 6 centimeters now, but just the idea of like connecting with the body gives that sense of autonomy, that sense of control, and that confidence boost to advocate for what they want in birth, which I think possibly maybe part of why we see decreased episiotomy rate in some of the research. So I don't know if I even answered your question.
Yeah.
Just kind of went off on a tangent.
No. I thought that was great.
No, yeah. And I completely agree. I feel like when clients come in and they're either curious about it or I bring it up, it's never like, okay, and then at this time we will start perineal massage.
Right.
It's always a conversation that we're having with our clients on educating exactly what you said about what the research says, what the evidence might be, what's, you know, their personal preference, and then we'll kind of make that decision together. Because I think a lot of times too, maybe having clients come in even like before the birth or after the birth, where again, they feel like I don't have any control over this situation, which I think is okay to say, like, this is my plan, but if things change, I recognize that might happen. Right. That's one thing. But the people who, you know, the clients who are like, well, I just want to do whatever my doctor, you know, says, and kind of just relinquish all kind of autonomy or control, or come in after the fact and they said, I did this because my like doctor said, or my midwife or whomever said that this is what, you know, we should do. And I wish I hadn't done that.
Exactly.
So I never want to be the person that is giving someone that experience. But I think from your standpoint of providing the education from, you know, the get-go of being your own advocate, you know, that you are in control of the situation, helps with just satisfaction with birth outcomes, regardless of what happened, if it went exactly to plan or if we strayed from the plan a little bit. So I think involving the client in every single decision with anything that we do, because they're going to get more benefit out of the intervention as well. Exactly. So
absolutely. Yeah, and I think a lot of times people hear about perineal massage, whether it's like online or they saw some TikTok or something. I have so many people that are getting information from TikTok, which is like mind-blowing to me for many reasons, but that's
right. That's a whole other discussion.
Topic. But anyway, so people like come across this like term and then they're like, okay, I'm going to birth class, so I'll ask about it then. And like perineal massage, I think of it as one of the many potential tools, options, skills you can do to potentially protect the perineum. One thing that's so interesting to talk about with the research on perineal massage is that it doesn't show negative side effects. So we don't have research. We actually, well, let me go back for a second. So some of that research shows that the more frequently somebody does perineal massage, the lesser benefit there is, which I think is interesting too. But anyway, it's not like we see, okay, everybody that's doing perineal massage is more likely to tear. We're not seeing that. So it's like, here's one thing you can do. Here are other things you can do. You know, like, let's talk about breathing, like you said. Let's talk about birthing upright. Let's talk about not purple pushing. Let's talk about bringing the knees together. Let's talk about lengthening the pelvic floor as we inhale. So it's like, talking about perineal massage, in my experience as a birth educator, is often like kind of opening the doors to talking about all sorts of things to protect the perineum. And again, I can't emphasize enough, not just because I'm on here with you guys, but I think any of my classes would attest to this too. It's also an opportunity to connect people to pelvic floor PTs, which is a crucial part of, in my experience, both personally and professionally, I feel like it's a crucial part of that collaborative care, and really having a let's say more comprehensive care plan for birth. And honestly, like, it's one thing to talk to somebody about, okay, like, let's put your finger in like 1 to 2 inches inside your perineum and just like press back or press on the sides. But it's totally different to have guidance from a pelvic floor PT showing you, talking to you, telling you where there's tension, saying to you, like, do you notice it feels a little more tense on this side than the other side? That is a totally different thing than you know, in a 15-minute midwife or OB visit being like, okay, do perineal massage from 36 weeks on. This is how you're going to do it. Like, there you go. You know, it's a totally different thing. So, I think we need better research. You know, we need better research, and we need more of that, like, holistic, individualized approach.
Yeah, I mean, that's kind of what I feel like, you know, as we both listened to the podcast that was going on and then talking to you, we were both just like, well, that's great, but
yeah,
who's doing more? Like, we need more, because you can say those things about any research that's out there, from, you know, the big thing of like all the COVID vaccines to, you know, childhood development, to all these things that are coming up, is that we can say all these things of like, well, this didn't show this and this didn't show this. And I think research is so beneficial as like a place to kind of stand on. But at the same time, I think, Britt, you brought up a great point that like evidence-based is not just follow the path of the research, but also remember you have the opportunity to stand up for yourself and make a decision that feels best to you with the information that you're given. And I think a lot of people, even in the orthopedic PT world, are like, well, we're going to do just this exercise or just this thing because it showed. And it's like, well, that might make no sense, because if you think too about on the flip side of it, there's people who don't need perineal massage. And who's talking about that and classifying who should be doing pelvic floor massage and who should not be doing perineal massage? You know, I assess clients. It's been a cool thing to be able to see people about their second baby, third baby, even fifth baby. We've seen some clients through, and it's just neat to check and to see our skills develop, but also to see their bodies change and shift. That like, yeah, honey, no, that U-shaped muscle that we're talking about, that levator hiatus, that is the space between the pelvic muscles where the vaginal opening is, that, no, honey, you're at least 3 to 4 fingers. That means you don't need anything. Like, your body will take over, you'll do the right thing and go from there. So it's really a, like you said, like, there just needs to be more in-depth research.
Yeah.
For sure.
Yeah. And that individualized approach, I think, again, like my world is like, you know, childbirth, and there are so many blanket recommendations given to people. And we have this really this kind of factory system of childbirth care in this country. And it's really unfortunate because sure, we may see benefit for some people, but when we apply interventions, whether the intervention is perineal massage or whether it's continuous monitoring or whatever, but when we apply those interventions routinely without taking an individualized approach, we wind up potentially with more risk than benefit. So we really need a whole shift in care, which is slow work for sure. But, getting rid of this idea of okay, everyone's going to labor the same way. And if they don't, then they're this person's abnormal in their labor. No, we need
or whatever. Right.
Exactly. We need to recognize that each individual experience is going to be different. Everyone's body is different. Like you were saying, the tension or laxity in their muscles is going to be different. And the more we can take, again, a collaborative, comprehensive, individualized approach to care, the more benefits we're going to see. But, again, I feel in the conventional childbirth world, that's a harder thing to come by. It's possible, definitely, home birth midwives obviously take a very individualized approach. There are also smaller midwifery practices in our area, as well as, all over. They take a much more individualized approach. But when we have a large hospital-based midwifery or obstetrics practice, it's really difficult to get individualized care.
It can be.
When I was diving into